are some of the stories making headlines on NBC News Daily.
Do you remember these pictures from a few months ago? Googly eyes randomly appearing on public art in Bend, Oregon. And now one prankster has come forward. Jeff Keith says he placed the eyes on some of the artwork in December, but then more people just joined in for fun. He says he came forward once he learned about damage that the eyes could have caused on the art. He says he has offered to pay for the repairs, but he has yet to hear back from the city.
In a new court filing, a law firm has released security footage that it says shows the start of the deadly Eaton fire in Southern California. The attorneys say the video appears to show electrical sparks from a power line, which then erupted into flames. The firm is suing the utility company Southern California Edison on behalf of a woman whose house was destroyed by that fire. The security footage from a Pasadena gas station was edited by the firm before it was released. The Eaton fire killed 17 people and burned more than 14,000 acres. Southern California Edison says it is reviewing this video. The company has said it does not believe its equipment started the fire. State investigators say they have not yet determined the cause.
Rail company Norfolk Southern and the community of East Palestine, Ohio, have reached a $22 million settlement. It comes, of course, nearly 2 years after that freight train derailed in the town, forcing people to evacuate. 11 of those train cars were carrying hazardous materials. Officials said the money will be used to, quote, priorities identified by the village in connection with the train derailment.
In today's Daily Health, we are digging into the potential health impacts of President Trump's latest executive orders.
Yeah, we're looking at two in particular. First, the Centers for Disease Control and Prevention, or CDC, has been told to stop working with the World Health Organization immediately. The other issue is the one that we mentioned earlier this hour, a pause on all federal aid, including loans and grants to organizations. NBC News medical analyst Dr. Vin Gupta joins us now. A lot to talk about. Dr. Gupta, so the WHO, the World Health Organization, and the CDC historically have worked together. They share data, they collaborate on research. So what happens if they don't talk to each other?
Well, Kate, without any dialogue, we're not really information sharing. What we've realized with the pandemic is that we don't know everything that's happening in the world on emerging threats. You and I and Sinclair have been talking about bird flu. How is that changing? What should we be keeping an eye out on? What diagnostics do we need where we don't have diagnostics? The lack of dialogue here has clear impacts on global health security and, frankly, on our hospital preparedness here in the United States. That impacts every single American when it comes to what happens in 6 months.
And let's talk about the pause on federal assistance. Still a lot of questions, but what might some of the immediate impacts be?
I mean, we might see this later today, but SNAP benefits, people who rely on those benefits for purchasing of basic essentials, funding to community health organizations, federally qualified community health centers across the country. Millions of people rely on those institutions for their basic healthcare needs. Education institutions, NIH studies, and NIH grants. I mean, all these things are being put at risk right now with what is, frankly, an unprecedented declaration. This is not something that typically happens at the start of administrations. Pauses on communication, sometimes that does happen for a brief period, just for a reset. But pausing financial assistance for these programs, that's without precedence. This is not normal.
And we mentioned earlier this hour, the White House is trying to say this is not going to impact direct assistance to direct individuals. But you wonder, if the government isn't supporting organizations and they lose funding, is there enough private funding to fill the gap for those health organizations?
No. Unfortunately, no. The answer is we need public-private partnerships. But, Kate, we don't have frankly, there's a 20 to 30 million people who are already falling through the cracks when it comes to underinsured or uninsured. Private funding is not closing the gaps there. So it's not going to close the gaps for these needed, say, federally qualified health centers that rely purely on federal dollars to run their pharmacies and their clinics.
All right. Dr. Vin Gupta, thanks for being with us.
Thank you.
Appreciate it.
President Trump has made tariffs an important part of his foreign policy plans. He used